Have you ever stopped to wonder, what if our whole approach to getting better, to healing, is kind of backwards? Today, we're going to dive into a totally different way of looking at medicine, one that really challenges how we've been taught to fight off disease. I mean, think about it. We have made some unbelievable progress. We've mapped the entire human genome. We can look at our health right down to the molecular level. And yet, so many chronic diseases, things like cancer or autoimmune conditions, are still just incredibly tough nuts to crack. It really makes you wonder, are we even focusing on the right part of the problem? To really get what I'm talking about, let's look at a fascinating little puzzle. It's called NTM, which stands for non-tuberculous mycobacteria. Now, these bacteria are, and I mean this literally, everywhere. In the soil, in our water, even in the dust floating around your room. Most of us are breathing this stuff in all the time, and it's no big deal. But for some people, an NTM infection becomes this devastating long-term illness. So why? What's the difference? Well, the way we usually handle this is we declare war. The strategy is to just attack the germ with a whole cocktail of powerful, sometimes pretty toxic antibiotics. We're talking treatments that can drag on for a very, very long time. But here's the problem. This all-out assault, it often just doesn't work. The bacteria hangs on, and the patient is left completely wiped out, not just from the illness, but from the brutal side effects of the so-called cure. You know, there's this quote that just absolutely nails this whole philosophy. It says most Western medical treatments we do are just putting out fires. That's it right there. It's all about firefighting. We see the flames, we rush in to put them out, but we almost never stop to ask what started the fire in the first place. And because we don't, it just keeps coming back. And this whole firefighting mindset is baked right into the way we name our drugs. We see a symptom, too much acid, high blood pressure, an infection, and we design a medication to just stop it in its tracks, to block the process. The focus isn't on fixing the function, it's on stopping it. Just listen to the names of common medications. For acid reflux, you take a proton pump inhibitor. For high blood pressure, it's a calcium channel blocker. For infections, we use antibiotics to kill bacteria. Do you see the pattern? The strategy is almost always about fighting, blocking, and suppressing. Okay, so this is the absolute core of it. We're looking at two completely different philosophies of healing. On one hand, you have the conventional approach. Block the symptoms, attack the disease. That's the firefighter. On the other hand, you have an alternative, an idea behind a treatment called SNEPI. And this approach is all about optimizing your body's own function, about strengthening it from the inside out. The metaphor changes completely. We go from being a firefighter to being a gardener, watering a tree. And that is the huge paradigm shift. Let's go back to that NTM bacterium. What if the reason it makes some people sick isn't that the germ is so incredibly powerful? What if the real problem is the environment it landed in? The person's lung tissue was already weak and couldn't defend itself. The whole focus shifts from the invader to the homeland. This is where SNEPI comes in. It's not a drug designed to kill NTM. Instead, it's a treatment with one primary job, to optimize the supply of oxygen to the body's tissues. The idea is that if you can restore this really fundamental process, you're not the one curing the patient, you're just creating the perfect conditions for the body's own natural life force to step in and do the healing itself. I just love this analogy. It makes it so clear. If you saw a dying tree with withered branches, you wouldn't try to fix it by painting its leaves green or spraying the bugs off the bark. No, you'd give it water. You'd give it the one thing it needs to heal from the inside out. That is the entire philosophy here. SNEPI is like watering the tree. So how does this work? Well, you can think of it as a logical chain reaction. Step 1, the treatment helps improve how the tissue itself works. Then, as that tissue gets healthier, the tiny blood vessels inside it start to wake up and become more responsive. And once those vessels are working right, they can do their job properly, which is to optimize the delivery of oxygen. And finally, once the cells are getting all the oxygen they need, the body's own internal repair crew can finally take over and get the job done. Now, this is why a single approach like this can help with so many conditions that seem totally different on the surface. You've got NTM in the lungs, asthma in the airways, a chronic cough. They're all different problems, but the underlying principle is the same. If you can restore the health and oxygen supply to the local tissue, you're giving the body a real chance to fix the problem at its very root. So the big takeaway from all this is really a shift in how we see things. Maybe true, lasting healing isn't found in a bigger, stronger weapon to fight our symptoms. Maybe it's about gently and patiently creating the right internal conditions, kind of like a well-tended garden, that allow our bodies to do their own remarkable recovery work. So it leaves us with one last really important question to think about. When our body is struggling, when we're sick, what does it truly need from us? Is our first instinct to go looking for a stronger weapon to attack the problem? Or should we be looking for a helping hand to support the incredible healing intelligence that already exists inside every one of us? That's a powerful thought to end on.